Two patients come through my doors on the same shift last week. The first waited 9 hours at home with chest pressure because she didn't want to waste anyone's time. By the time she arrived, a problem we could have caught early had become a much bigger one. The second drove in at 3 a.m. for a splinter, then spent 4 hours in the waiting room and left with a bill that could have bought a very nice holiday. Both of them made the same mistake. They didn't have a way to answer one simple question. Do I need to be seen right now or not? G'day team, and welcome to Overheard in the Emergency Room. I'm Dr. Cois, emergency physician, evidence nerd, and your guide through the messy, fascinating world of medicine. This is the video I wish every one of my patients had watched before they came in, because by the end of the next 10 minutes, you'll have the exact framework I use so you can run it on yourself or someone you love. A little bit of quick housekeeping before we dive into this episode. If this channel is new to you, this is the home base, the framework video that every other should I go to the ER video on this channel links back to. So do me a favor and subscribe, because the follow-up videos we build directly on what we cover here. So do me a favor, like, subscribe, and comment on this video, because the follow-up videos from here on will build directly on what we cover here. Right, let's get into it. Here's the thing that nobody tells you. There are two ways to get this wrong, and they're mirror images of each other. The first is underreacting. You talk yourself out of a real emergency because you don't want to be dramatic, and you lose the window where we could have helped you most. In emergency medicine, time is tissue. For a heart attack or a stroke, the minutes you spend convincing yourself it's nothing are the minutes that decide how much of your heart or brain we get to save. The second is overreacting. You go to the most expensive door in the building, the emergency department, for something a pharmacist, a telehealth call, or a good night's sleep could have sorted. You wait for hours behind sicker patients, and you walk out with a bill and no real benefit. So the goal isn't to be braver, and the goal isn't to be calmer. The goal is to be calibrated, and calibration comes from a framework, not from a gut feeling at 2 a.m. Let me give you mine. So everything starts with one central question. Before you think about clinics or copays or anything else, ask yourself this: could this seriously harm me in the next few hours if I do nothing? The question sorts almost everything into 3 lanes. I like to think of them as traffic lights. So the red light situations. Just call 911 or 000, depending on where you are, and do not wait. These are the time-critical emergencies, and your job is simply to recognize the pattern and pick up the phone. Crushing chest pain or pressure, especially with sweating, nausea, or pain into the arm or jaw. The stroke signs. Remember the word fast. Facial drooping, arm weakness, speech difficulty. Time to call and get in and be seen. Sudden trouble with breathing, the worst headache of my life, that arrives like a thunderclap. Severe bleeding that won't stop with pressure, a serious allergic reaction with swelling or throat tightness. Sudden confusion, a first ever seizure, or fainting with no warning. If you see any of these, you are not overreacting. You are doing exactly the right thing. And one rule that lives inside the red light: call, don't drive. People feel silly calling an ambulance, and I get it. But the ambulance is not a taxi. It's the start of your treatment, and the paramedics can begin care en route. For chest pain and stroke especially, that phone call is part of the medicine. And I want to also add here, if ever you're worried about anything, regardless of what it is, and even if it doesn't fit into those symptoms, you should be seeing that as a reason to come to the hospital. So the next is the amber light. You need to be seen today, but it probably isn't life-threatening. This is where urgent care earns its keep. A deep cut that might need stitches, a lightly broken finger or toe, a high fever with productive cough, a urinary infection, a sprain you can't weight bear on, a flare-up that's worse than usual but stable for a chronic condition. Urgent care is faster and cheaper than the ED for these, and it exists precisely so the emergency department can stay clear for the red light cases. If urgent care looks at you and thinks you need more, they'll send you to the emergency department. And that's a feature, not a failure. The green light. These are things that can wait, and it belongs with your regular doctor. a rash that's annoying but not spreading fast, a cough that's hanging on after a cold, a medication question or re-prescription, a lingering injury that's been there for weeks. Green light problems are not best cared for in emergency departments, and certainly sitting in a waiting room can make it worse. Book your primary care appointment, use a telehealth visit, or call a nurse advice line. You'll get more thoughtful care and you'll keep your evening. Now, and this is the most important part of the whole video. When you are genuinely unsure, treat it as the more serious lane. If you can't decide between red and amber, just call 911. If you can't decide between amber and green, get seen today. The framework is built to make you confident about the obvious calls so you have the bandwidth to be cautious about the close ones. No one in my department has ever been annoyed at a patient for coming in scared. We are annoyed at the disease, never at you. So let's pressure test this. You wake up at night with indigestion type discomfort in your chest. Run the question, could this seriously harm me in the next few hours? Chest discomfort sits in the red light lane until proven otherwise, because the cost of being wrong is catastrophic and the cost of being checked is a few hours. Your child has a fever but is drinking, playing and settling normally. Could this harm them in the next few hours? Almost certainly not. It's the behavior, not the thermometer that matters. Depending on how they look, you watch, you rehydrate, you call your doctor if anything else shifts. Make sure you give them regular Tylenol and ibuprofen. Make sure they're still eating and drinking. Here's a few honorable mentions that change which lane you're in. Know your medications. If you take a blood thinner, a bump on the head or a fall moves you up the light system because bleeding is harder to control. And age matters at both ends. Very young children and older adults can be sicker than they look, so lower your threshold for those groups. Your gut counts as data. If something just feels deeply wrong, that instinct is information and act on it. And just use the tools between the emergency department and nothing. Things like nurse advice lines, telehealth, your pharmacist, they can be free or cheap and they are very good at telling you which lane you should be in. So here's the whole framework in one breath. Ask this question, could this seriously harm me in the next few hours? If it is, it's a red light. You should call 911. An amber light means you need to be seen today, usually at an urgent care. And the green light is you need to book your appointment with your doctor. And when in doubt, move up those scales, not down. And here's your tier 1 callback, because regular viewers know I end every one of these in the exact same place. The single best tool for staying out of my emergency department is a primary care doctor who actually knows you. A doctor who knows your history is your personal triage line. The person you can call before things escalate. The one who catches the green light problems before they ever turn red. If you take one action from this video, it isn't memorizing a symptom list. It's booking the checkup you've been putting off. That relationship is the highest leverage health decision most people never ever make. And that's your framework. If it made the picture clearer for you, I've got 3 quick asks. Subscribe and hit the notification bell. This is the pillar, and the next videos in the series take each red light emergency and break it down one at a time. If you can, also drop a comment telling me which symptom you want me to cover first. And share this with a person in your life who always says they don't want to be a bother. This one is for them. The first deep dive is already queued. How to tell whether chest pain is a heart attack, and what to do in the first 10 minutes. The companion guide with a printable version of this framework is waiting for you at drcois.com, so head over there and check it out. I'm Dr. Cois. Let's chase less bad days and more good decades together. See you next time, and hopefully not in my emergency department.